Hello, my name is Mark Gatz, I am a doctor. Today we will talk about the health benefits of drinking baking soda, or sodium bicarbonate, dissolved in water. You can find a lot of articles on this topic on the internet, but remember that not all of them are based on solid scientific evidence. That's why I've gathered reliable information for you, based on scientific research, to discuss how baking soda can support our health. I will also answer many frequently asked questions, such as, how much soda to consume? What are the contraindications, possible side effects, drug interactions? Does soda relieve heartburn, destroy tooth enamel, support the treatment of acne, and many others? If you are interested in this topic, please watch until the end. Now we will discuss practical home uses of baking soda and then move on to medical indications, where I will support specific scientific research described in the articles. Baking soda as a stain remover. Baking soda is a great solution for removing old stains on mattresses or underarms from t-shirts. Prepare a solution of soda 1 teaspoon with dishwashing liquid 1 teaspoon 100 milliliters of water and treat the stains with this preparation and leave for 15 minutes. Then wash in the washing machine. Does baking soda help treat acne? The use of baking soda on facial skin is controversial. Baking soda changes the pH of the skin, which can lead to dryness and irritation. I recommend using dermatologically tested cosmetics. Does baking soda lighten hair? There are no scientific studies confirming baking soda lightens hair. Long-term use of baking soda on the scalp may increase hair brittleness and damage. How to check the freshness of baking soda? To check whether the baking soda is fresh, pour warm water over it and add a few drops of vinegar or lemon juice. If it bubbles a lot, it is fresh. How to store baking soda? Baking soda should be stored in a tight container in a dark and cool place. It is recommended to use within 6 months of opening. Baking soda neutralizes unpleasant odors and helps remove the smell of garlic from your hands. Just wash your hands with baking soda paste after cutting, for example, garlic. This paste can also be used as a natural antiperspirant. How to prepare it? This paste can be stored in a jar for up to 6 months. A jar of baking soda powder can replace the odor absorber in the refrigerator. Baking soda can also remove pesticides from fruits and vegetables. In the summer, baking soda can relieve itching after mosquito bites in the form of a thick aqueous solution in the proportion of baking soda water. Please remember that baking soda solutions may cause allergic reactions in some people, so their use should be preceded by a skin test. Now we will move on to the medical uses of baking soda. As a doctor, I will support myself with scientific articles so that you can be sure that what I am talking about is true. Scientific research shows that sodium bicarbonate has a positive effect on our oral cavity. One of the meta-analyses, the highest quality scientific research, checked the effect of toothpastes containing 20% and 35% baking soda. It has been found that regular use of such toothpaste significantly reduces dental plaque and inflammation and bleeding of gums. These results were better than those obtained with fluoride-only toothpastes. Interestingly, other studies have shown that baking soda products are more effective at removing plaque from hard-to-reach places, such as between teeth. In addition, baking soda has a bactericidal effect against oral pathogens, including Streptococcus mutans bacteria, which cause tooth decay. Baking soda also raises the pH of saliva, which prevents demineralization of the enamel and supports its reconstruction. Therefore, soda-based mouthwashes can be an effective alternative to specialized ones. Additionally, research confirms the safety and effectiveness of baking soda in removing tooth discoloration, especially when using an electric toothbrush. Moreover, one study proved that baking soda can be an effective disinfectant for dental implants during the treatment of periimplantitis. Research has shown that it can neutralize 3 groups of fungi, yeasts, dermatophytes and molds that cause skin and nail infections. In some cases, fungal growth was inhibited completely. It has also been shown to be effective against fungal infections in immunocompromised people, for example during COVID-19 infection called mucormycosis. Mucormycosis is a fungal disease. Although mycosis seems to be a minor disease for most of us, it can even lead to death in people with weakened immunity. Baking soda may also alleviate the symptoms of psoriasis. A study of 31 patients found that bathing with baking soda significantly relieved symptoms such as itching and skin irritation. Most study participants continued treatment even after it ended, showing the effectiveness of this approach. Lower urinary tract studies have shown that oral use of baking soda by increasing the pH of urine can be an effective treatment for overactive bladder syndrome (OAB) and reduces the frequency of urination. A similar effect was obtained in another study, where it was proven that baking soda supplementation can alleviate lower urinary tract symptoms by increasing urine pH and reducing the frequency of urination and problems with urinary incontinence (UI). Therefore, it can be concluded that supplementation with baking soda above 4 grams per day, a teaspoon is about 5 grams, has a beneficial effect on the condition of the urinary tract. Cystic fibrosis is a life-threatening multi-organ genetic disease, particularly affecting the lungs, where recurrent infections are the main cause of shortened life expectancy. Baking soda, due to its bacteriostatic and mucus-thinning properties, can support the treatment of cystic fibrosis. Cystic fibrosis (CF) is characterized by thick, viscous mucus that is responsible for both airway obstruction and resistance to drug diffusion, reducing the efficiency of drug delivery to the lungs. Studies on patients have shown that baking soda inhalations reduce the viscosity of sputum and facilitate the penetration of drugs used to treat cystic fibrosis. It can therefore be assumed that inhalation with a baking soda solution will accelerate the treatment of this disease. Baking soda can improve exercise capacity in various sports, such as boxing, judo, jiu-jitsu and taekwondo. Soda supplementation increases physical performance, which is confirmed by numerous studies. Improves results in intense cycling, short-distance running, rowing and swimming. These findings suggest that NACO3 supplementation may improve the later stages of sprint interval swimming, which is likely due to an increase in pH and HCO3 before exercise and a subsequent increase in buffering capacity during exercise. Baking soda also improves the condition of muscles and bones after increased exercise by reducing the acidification of the body. How much baking soda should you consume daily? The recommended dose is 4 to 8 grams per day, dissolved in a glass of water. The minimum dose is less than a teaspoon. With greater physical activity, the dose can be increased. However, baking soda should not be used for longer than 2 weeks. Consuming baking soda is not recommended for people with metabolic or respiratory alkalosis, hypocalcemia, hypernatremia, congestive heart failure, renal failure, sarcoidosis, dehydration and water and electrolyte disturbances. Any decision to use baking soda supplementation, which is alkaline and increases the body's pH, should be consulted with a family doctor. Appropriate and short-term consumption of baking soda for up to 2 weeks usually does not cause side effects. Problems arise with excessive and long-term use. Metabolic alkalosis, muscle pain, headaches, nervousness, nausea, vomiting and others may occur. In case of long-term use, we should constantly monitor our medical parameters such as calcium, sodium levels, electrolyte balance, heart and kidney function. Please remember that despite the very wide range of positive effects and effects of using baking soda, it should be taken carefully and in moderation, preferably under the supervision of a doctor. Sodium bicarbonate therapy (SBT) is currently indicated for the treatment of a variety of acute drug poisonings. However, as the study showed, its improper use may lead to heart failure or even death. Baking soda may interact with antibiotics minocycline, doxycycline, nonsteroidal anti-inflammatory drugs sulfasalazine, mesalazine, ketoconazole and antacids. Drinking soda on an empty or full stomach? It is better to consume soda on an empty stomach to avoid damaging it. Baking soda relieves heartburn only temporarily. A better solution are products that eliminate heartburn and are supported by scientific research. Does baking soda destroy enamel? Research shows that baking soda pastes are safe for enamel and are characterized by low abrasion. They also have antibacterial and anti-inflammatory properties. Thank you for staying with us until the end of this episode, in which we introduced you to the fascinating world of baking soda and its potential health benefits. I hope that the information presented was helpful to you and dispelled many doubts related to its use. In summary, baking soda can be a valuable addition in both home and medical applications. Its versatility and accessibility make it an invaluable tool in many situations. However, like any drug, it should be used in moderation and with awareness of its effects. Thank you for your attention, and I hope this episode provided you with valuable information. If you have questions, suggestions, or want to share your experiences, leave a comment below. Don't forget to subscribe to our channel so you do not miss the next episodes about health-related topics. See you in the next video, and I wish you health and success in your daily self-care.